Hey guys, Montel here, and welcome to this edition of Let's Be Blunt with Montel. I'm so psyched to have my guest on today because my guest has a big history. He transitioned from an extensive career in traditional healthcare to the cannabis industry. He held leadership roles at numerous public companies and brings a wealth of knowledge to his new role as the CEO of Botanical Sciences, Georgia's first physician-owned vertically integrated cannabis company. Gary Long, thank you so much for being a part of Let's Be Blunt with Montel today, sir.
Hey, thank you, Montel. It's great to be here.
Absolutely. Look, before we dive in, let's get a little bit about you. Let's talk a little bit about your background. Where you're from? Where'd you grow up? Where'd you go to school?
Yeah, originally from Hollywood, Florida. My dad took a transfer to Atlanta in the mid 70s. We moved to Atlanta, Georgia, and I'd spent my entire school age years in Atlanta, and then eventually went to Auburn University as an undergraduate and graduated there in the early 90s. And then, like you said, kind of jumped into what was a growing healthcare technology field at that time, because back then, everybody will remember, there was nothing but paper records that people had on their healthcare. And I got to ride that wave through my career in a few companies and just helping kind of digitize healthcare. So it's been a great ride. And then this most recent move in the last couple of years, moving into the cannabis space, has been incredible.
Let's stop right there for a second. Let's talk about that. I mean, okay, you're working in high tech medical field, and all of a sudden you said, I heard about this stuff called cannabis. No, it didn't happen that way. How did it happen?
Well, had plenty of experiences earlier in my life, with cannabis recreationally, and I never really thought about it as a medicine because, I grew up in the generation where it was, just say no to drugs.
Sure.
And so, over the years, starting to see and hear how cannabis was being used in a healthcare setting was pretty intriguing to me. And Dr. Fowler, who's the founder of our company, he and I actually were college roommates at Auburn. So back in the late 80s and early 90s. So as our careers developed and we stayed in touch, back, I would say just around 2018, 2019, as he was starting to think about his next step in his career, we heard that Georgia was going to be going through this medicinal cannabis process. And we thought it was a perfect fit for especially his background as a pain practitioner, an anesthesiologist. And then eventually, if the moons aligned, potentially my involvement as well. So initially, I was just operating in almost like an advisory capacity to help him stand up the company. But then things kind of all came together when Botanical Sciences got awarded the license, and then Robin asked me to take over as the CEO. So incredible how things work together, isn't it?
Absolutely. And I guess you probably did some extensive research yourself looking at it from a medicinal standpoint, right?
Yeah, totally. And especially on the heels of the opioid crisis, like a lot of folks, it opened my eyes to really the craziness that has gone on in our country for the last probably 20 years with the pharmaceutical industry and how they have operated in many ways. And it's not necessarily just on their shoulders. There's a whole complex of companies and an industry built around this. So the mere fact that we could be, selling a product to treat patients who have severe disease and to give them relief without having to take an extremely dangerous pharmaceutical drug, I think how could you not get on board with something like that?
So Gary, tell me just a little bit about Botanical Sciences. Well, first off, I think what we ought to do is first talk about the difference in the Georgia state law and some of the other laws, and then tell me about Botanical Sciences.
Yeah, sure. Be happy to. Georgia went through its process just before the pandemic in 1920 and then eventually in 21. And our state's a bit unique in that it's a low THC oil. So it's 5% is the max percentage. But that doesn't necessarily hinder us as a company or patients for that matter. Look, it's good. The fact that we're out selling products today, we're super pleased about. Our state is generally conservative in nature, but is becoming more progressive as it relates to the conditions, the uses, the lessening of severity of disease that they have for some of the qualifying conditions. But one of the most unique things about our market unlike any other state, quite honestly, is that we can actually dispense our products through independent pharmacy. So this has gotten a tremendous amount of interest from other states, and quite honestly, at the federal level, that the Georgia Board of Pharmacy, which governs the pharmacies in our state, authorized that as part of the law. So not only are we dispensing our products in our own dispensaries, which we have 5, but we're also authorized to sell through these independent pharmacies. And actually, the way the law reads, Montel, is that it's any pharmacy, but it just so happens because independents are locally owned and operated and are not kind of getting federal dollars, that they feel like they're equipped to be able to jump in with both feet. And we've taken great advantage of that. They've been great to work with in the sense that these are enterprising business owners, many of them, and they operate in urban, suburban, rural settings all over the state. So right now we have nearly 140 pharmacy partners that are carrying our products exclusively in addition to our 5 pharmacies. So we create this incredible network of access almost instantaneously in our state.
And that gives you a footprint to cover
Yeah.
almost the entire state. Well, not the entire
The
state.
entire state. Yeah. And in fact, the statistic that we ran recently was about 90% of the state's population is now within a 30-minute drive of obtaining our products.
That's incredible. And I should say, for 100% complete disclosure to all of our listeners out there, that I've kind of partnered with Botanical Sciences to bring my Inspire product line to Georgia patients along
Yep.
with your products. And the products that we're going to be putting out are still being approved because each one of them has to be approved at the state level first.
That's
Is that right?
correct. Yeah, and we're so looking forward to that when that happens. That'll be later this year, but we're really excited for that opportunity.
I am so excited about this opportunity also. And I should also say again, complete disclosure, I've been down to the state now a couple of times for your openings of each individual dispensary that you've opened. And I got to tell you guys, I think there is an example here in Georgia that the rest of the country could stop and take a look at. Let's go back for a second to that 5% THC. That's 5% by
Yeah,
volume, correct?
correct. That's correct. And
Which,
and so like, if patients require a higher level of dosing, then obviously they'll just be able to consume a little bit more than your traditional. So the forms of the product come in like tinctures and topicals and capsules and lozenges now. And then we sell them in different varying potencies of THC to CBD concentration. So patients like that have a lot of neuromuscular disease, MS, Parkinson's, those types of things, require a larger dosage. And so those folks that we are working with who consume our products are just taking a larger percentage of the drug.
absolutely. And I tell you, I noticed that. I mean, first off, at the turnout to your events, you have politicians, you have local
Yeah.
officials, you have lots of people who are patients who actually show up to hear more. Um, I did think that part of the law is a little strange in the sense that it says no edibles, but you can have a tincture. So
It's,
you put a tincture in your mouth, so that's an edible. But
yeah.
are we working at expanding the
Yeah.
delivery systems?
Yeah, I mean it's a great point, and far be it from me. I thought you could apply logic to a business that when you're dealing with the state government and politics, and it's like I don't get it. But
Mhm.
like I said earlier, this our state is open to changing its mind and opening this up a bit. We've got a legislative session that starts in January, and I know things like this are going to be on the docket. There will be the opportunity to increase the uses, the delivery methods, to broaden the set of diseases that are on the registry, you name it. So I think we're going to see a progression, not unlike other states. I mean, many states that started with a medicinal program went really slow and conservative to start, and then eventually progressed into a much broader and widely uh, used system. So we're excited for that opportunity. But you're right. I mean, today we can sell a lozenge, which contains the combination, whatever is THC to CBD in it, and you're not allowed to chew that product because you have to just let it dissolve in your mouth. The way
Yeah.
the state refers to it as a dissolvable form. But I would say eventually we're going to be having the opportunity to introduce like gels and those types of things. Also, other dissolvable forms of the product we're currently working on today are things that would mix into a drink, as an example. if you're familiar with those types of products that you can buy in a
Sure.
store today. So those are things that are coming down the pike in addition to almost like a Zicam dissolvable tablet, if ever you ever consume that type of a product.
Of course. Yeah. Hmm.
A Listerine strip type of a product too. I'm using these brand names, but you get the point.
Sure.
So those all are acceptable forms of use today, and we're in the process of R&Ding quite a few of those in addition to the line that we carry already.
And now in Georgia, smokable or vapable is not available, right?
Correct. Correct. Yeah, no smoke, no vape, and no quote unquote edibles today.
Do you think that this state will turn the corner and allow for vaping and for smokables or no?
I would say not this year, albeit I don't want to get ahead of what the legislative session might unfold with. But I just don't anticipate there's going to be smoking or vaping in 2024 in Georgia. But that doesn't mean in the future, it would change, right? Because things change, governments change, the mindset of a population changes. So we hope at some point in the future, especially for this medicinal use case, right? There are patients
Hmm.
who are consuming these products today in our state, and they're largely buying the products outside of Georgia, or they're buying them from the illicit market. Uh,
And that's something that we found is a little bit. I don't know. What do you call it? That's one of those things that I think the state's going to have to reconcile
yeah.
and deal with very quickly because of the farm bill
Yes.
and the hemp-based produced products. There are products like that available in
Right.
other stores,
That's right. I'll tell you, Montel, that to me, it's one of the most confusing things for the patients of our state is that today we have a completely unregulated intoxifying hemp industry. And so that's the Delta 8, Delta 9, Delta 10, THCA products, where you can essentially legally consume a flower product today. And it's bizarre because there's zero regulations, as I said. And in some of the dialogue that I've had with some of the top politicians in the state, they're not happy about it. I think there's some interest in creating controls and regulations around it, which is probably good news for everybody. But it is creating mass confusion among the population that those products are the same as the ones that we're selling, which they're not.
which is not.
They're not.
There's no controls, right? There's absolutely zero, oversight on how they're
That's
produced,
right.
whether they're using caustic chemicals. Hold on a second. It's my little puppy. Sorry. So, I mean, a lot of these products, and though I have not purchased any, and I would not consume any from any other place other than a licensed state authorized facility, I think this is something that we got to shout out to all of the consumers in the state. And if you're in Georgia, I'm telling you, you buying something from a bodega or you're buying something from a 7-Eleven, or I'm not knocking that brand name, but if you're buying something from one of these little kiosk places and it says that this is hemp-based Delta 9, you need to check yourself because you have no idea how this was processed.
Man, that's so true. In many of the conversations I've had with some of the top officials in our state who manage large departments, in fact, the words were said to me is like, don't let your friends or your family consume a lot of these products because a lot of what is being sold in Georgia is actually being dumped here from other states that have outlawed it. And so there has been zero regulations on the purity, the lack of solvents and heavy metals and microbials and those types of things in those products, let alone the fact you don't even know where it's been grown. Some products that are in our country were coming from China and from Mexico. And so again, by themselves, I think there are plenty of companies out there who do sell high quality products, but today without any regulation or controls, it's kind of a free for all. And I hate that for the people of our state and other states that haven't regulated these products yet.
And I mean, clearly, Botanical Sciences does differentiate itself from a lot of these other producers. I know there are other licensees that are there that are selling products, but I've not seen anything that comes close to the quality of the products that you guys are putting on the shelves.
Well, thank you for that. It's a deliberate attempt because, especially when you're entering a state that is conservative in the deep South, we wanted to make sure that the approach that we took reflected the values that we have and to make sure that people understood that we actually treat this like a medicine. Our company is founded by a physician. Everything we do puts the patient at the center of the journey. And so, I want my mother and my family to feel comfortable taking these products, just like I would if it was somebody in your family.
I mean, I'm telling you, I think some of the products that you have, I'm when I was in the dispensary, I like the fact that I'm not standing in a place where I've got 75 different, I don't know what you call them. The way that some of these products have been named in other states is
Yeah.
just crazy. And the fact that you are straightforward, this is like being in anybody's pharmacy. Honestly, it's like being in an independent pharmacy rather than being in a dispensary.
Well, I appreciate you saying that. I mean, that was intentional. As Dr. Fowler, just the mere fact that we've approached this as a medicinal market because it is, and being in a relatively conservative state, we wanted to make things simple and easy to understand, and have people feel good about the products that they're going to buy. And look, I think about it in terms of whether my own family or your family or friends and family of ours would be consuming these products. So we want to put the best possible products out into the market, make sure that the people have all of the necessary information that they need to make good, educated decisions with their healthcare. And that's really the basis for the company and how we operate.
Absolutely. Well, tell me a little bit about the landscape in Georgia right now. How many companies are there? I know
Yeah.
you have Botanical Sciences has one of only, what is it now, two
Yeah,
completely medical licenses?
correct. Yeah, there's two companies that are authorized to actually produce and dispense, and these are integrated licenses, like you said at the beginning, seed to sale. So we do everything from manufacturing the products, processing, and then distribution and dispensing. So there's one other company that has that capability, and that's a large MSO. Our state has four other licenses that are called Class 2 licenses. We possess a Class 1 license. And those authorizations for those companies was just issued last week. So there's a total of six companies. Those other four that I mentioned won't be selling products into probably the first quarter of 2024. So, we've been at this now for the better part of a year. And so we feel good about where we are as an industry, and the fact that our state, quite honestly, has taken an approach to have a limited number of license holders that are fully integrated in nature. So that is a difference of what Georgia has done versus what other states have done. And so far, I really do like it. I think it holds us accountable for the entire experience, which I think is better for patients, to be honest with you.
And those other four licenses now, do they have to get their feedstock from you or the other company, or are they
Well,
able?
yeah, they would be producing their own stock. Now, if they were interested in maybe carrying our products or something like that, we would be open to considering doing that. But as far as we know at this point, these are a couple of them are companies that operate in other states, and a couple of them are actually companies that were like Botanical Sciences, which were from Georgia and coming out of the ground to produce just in our state.
Okay, and then do they get to grow also, process, or do
Yes.
oh, they
Yeah.
do?
Yeah,
So
they do.
that's a
They do.
completely verbal license. Okay,
Correct, correct. The exact same type of license. They're just considered a class two is they call it a 50,000 square foot canopy capacity. And the class ones, like what we possess, is 100,000 square feet of canopy capacity. So double the size, double the production, and that type of thing. So that's why there's only two of us in the state.
and now I mean, this is a medical program, so therefore patients have to register, get a card, and so how many people total are registered in the state right now?
Well, it's kind of an interesting story. It's good to understand the context before I give you the whole thing.
Sure.
So, leading up into the middle of this summer, the Department of Health for the state of Georgia has been managing the patient registry, they call it. And that number that they have been quoting to all of us, the license holders and all the other constituents and stakeholders, was 30,000 patients. And somehow it got exposed earlier this summer that number was actually overstated by nearly double the number of patients. So right now, yeah, yeah. So there's actually somewhere between 13 and 15,000 patients on the registry. Now that number is growing. We are seeing it in our dispensaries. The numbers are increasing week to week, month to month, quarter to quarter. But just the mere fact that there was not a really good control over the patient registry didn't instill a ton of confidence in us. And so the Department of Health is the agency of the government that actually issues the cards. The way that the process works in Georgia is you would go to your doctor, whether that be your family practitioner or even a telemedicine doctor, and they, through an evaluation of your medical history and your qualifications against the diseases that are on the state's list, would then make a recommendation, not a prescription, a recommendation for you to receive your cannabis card. That recommendation is essentially achieved by them entering your name into the Department of Health portal. And then once that is processed, within about 10 to 14 days, you'll be able to go pick up your card.
And is there some sort of a cost to the patient or not a cost?
Yeah, I mean the patient will experience obviously the expense of going to their physician to have that consultation. That varies, as you would know, but the state's fee is very nominal. It's $25 to have a card. That card lasts for 2 years, so not a lot of money. Not super convenient at the moment because the patient still has to go to a local Department of Health to go pick up their card. That's something I think will likely change in the next legislative session to make it easy on folks, just the same way that you get your driver's license or your voter registration card. It gets mailed to you. So that's what we're hoping for in the next session as well.
And you do have, are there restraints on how you can promote or advertise on that? And when I say promote, advertise, I know you can educate, but can you, with that number of people that are participants, it seems to me as if the word's just not out yet. You know what I mean? I would think in a
Yeah,
state as big as Georgia, you would literally have 5 times that amount of patients.
yeah,
But that's
and
because people, go ahead.
yeah, you're exactly right. I mean, the expectation that the state had for the first 12 months was that we would be somewhere close to 100,000 patients. So you can see the discrepancy. Now that assumption was built off of the fact that we were starting with 30 and not 15. But at the end of the day, it is growing. What we do find ourselves in a very unique position is that the state has not done a tremendous job of promoting the awareness about these products in our state.
And
So
is it on the state to do that, or is it up to the licensees to
well,
roll
it,
them out?
it, it appears it's entirely up to us. And I'm just, was hoping for a little more partnership in that regard because the state does tend to benefit from this as well. But, without holding our breath for anything like that, we are going about creating the awareness as best we can, to make sure that the patients, number one, are aware and that the providers are also aware that this is a legal product for patients, especially many of the ones that you're familiar with. But I'll recite here, cancer patients, MS patients, any neuromuscular disease, PTSD and anxiety, generalized pain that is intractable in nature. So there's a whole host of conditions. I think there's 17 total conditions on the state's list, and we expect that to increase. Now, getting the word out through podcasts like yours and other forms of media has been our primary way to do it. We don't have unlimited funds to go do marketing campaigns and the like, so we're doing a lot of education, a lot of grassroots messaging and marketing with physician groups through the pharmacies, as I mentioned earlier. They've been a great channel to get the word out. So we're just very excited about the prospects, and the market is growing. It's just not growing at the pace that the state anticipated, nor did we.
Sure, and I think part of that might is definitely the word, getting the word out. Now,
Yeah,
I don't know if you heard a couple of weeks ago that the Senate passed a bill, though it's still got to be passed by the Congress, that is going to allow VA doctors to actually write recommendations now. And
yeah,
for veterans who are utilizing cannabis, that would not stop them from having access to their VA benefits.
yeah.
So, what do you think about that? Because that's something
That is
that's a part of the population that really, 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 I believe needs access to cannabis.
100%, and that is actually incredible news. I was aware of it, and just by evidence at the last opening we did where you attended, where we were celebrating Veterans Day, just the number of veterans who showed up and quite honestly haven't had access legal access to these products. It's just when you see it and you talk to these folks about the importance of this therapy and their treatment, it's heartwarming and it's sad at the same time because they haven't been able to get legal access to these products up until now. And so maybe this is a sign that things are going to change at a broader level. I think we're all aware of what was proposed by the Department of Health and Human Services to reschedule. It seems like there's some momentum behind this, but again, I can only hope that those changes come to fruition in the new year.
And I can only hope that, they come quicker because, again, those same veterans have access to these other products that are in the marketplace that are deleterious to the health, I think.
Right.
Some of the products that are out there that we know, they've tried something and say, well, cannabis doesn't work. Well, no, the kind of cannabis you were using doesn't work. Doesn't necessarily mean that it doesn't work overall.
That's right.
Do you feel like there's any movement at the federal level that other than this what we just saw with the Senate? And I find it really strange that the Senate would pass that bill and still out of the other side of their mouth say, "Our cannabis doesn't work." It's like it's crazy.
Yeah, it is crazy. There's a lot of hypocrisy, as you know, that just goes on in general. And I don't think people are maliciously doing it. I think there's just, when right before things change is where you see, and this will cut across any industry, is when you see kind of like the craziness going on. And I think that's what we're in the middle of right now. Is the majority of people in this country want and expect these products to be made available at a minimum for medicinal purposes, right?
I think the last poll that I just saw a couple of weeks ago was that it's at 92% of
Right.
Americans believe that cannabis should be made legal or at least medically available. 70, finally, for the first time in history, we've now broken 71,
Right.
72% of the American population believes that it should be just made legal, period.
Yeah, yeah, it's great. So I mean, you have the overwhelming support of the population, wanting this, and then you have elected and appointed officials who are grappling with how to make it work, and to go back on maybe some of the positions that they previously took. So it's kind of a crazy time. But I do feel like we're pioneering a bit in that way. And look, maybe we'll look back in a few years from now, maybe 5 years from now, and there will be, broad-based acceptance across the country, and availability of these products across the country for veterans and for patients of all kinds, and letting adults make decisions for themselves and not necessarily having the government make it for them.
I can tell you, it's really, I think it's what's so interesting about botanical sciences is what you started with when you said it's for patients by a doctor who has got a history in this, in pain management that spans 20 years.
Yep.
And, I think it's the kind of voice that needs to be heard on the national level. Is Dr. Fowler thinking about doing anything from a lobbying standpoint to the federal government? And of course, you got me. If you need me to go up there and
Yeah.
help out, I'm there.
Yeah, well, I mean, I think it's definitely something we should take advantage of, in the sense that, you know our purpose is to create legitimacy, if you want to call it that, behind this type of a business, especially in the state of Georgia. Like you said, having Dr. Fowler and his broad-based experience of working for one of the most prestigious health systems in the country as a pain practitioner, and then going off on his own and seeing how these products could have more or less, been used in place of many of the very serious opioid type drugs that he was utilizing as in his armament, um, really says a lot, right? Because for somebody to make that transition and to go from, let's call it, the traditional pharmaceutical environment to things that are plant based, as a go to. Now, I'm not suggesting that there isn't a place for those types of drugs in medical practice. That's not what I'm saying. But as you know, the overuse of those types of drugs has been what's created the problem, and the lack of education and awareness of the use of cannabis for the purpose of treating pain and treating some of these other severe disease states, in addition to just generalized symptoms. I mean, look, who doesn't know somebody that is suffering from pain or insomnia or anxiety? I think that covers the gamut of almost every person walking the face of the earth.
I
So I
often,
just
I
think,
often, I often say people who gravitate to cannabis, whether they think it's for medical reasons or not, if they stopped and checked themselves, they would recognize that almost
Yep.
everybody who gravitates to cannabis does so for medical reasons, whether it's to relax when you come home,
That's right.
whether it's to relieve your stress, whether it's to sleep better, whether
Yep.
it's to relieve a little pain. Those are all medical reasons. And I think, I'm sorry, I
I
didn't mean to
agree.
cut you off. You go. Yeah,
No, you're exactly right. That's the exact same way that we think about it as well. And again, when you talk to patients, and that's where we put our true north is what do patients say? And patients, are taking these products and they're getting the benefits that they weren't getting from taking the traditional pharmaceuticals, as an example. So, it's in the results, it's in the outcomes. And I think as our country takes on more of I would say an open-minded view about it and does the necessary studies, I think you're going to start to see more double-blind, placebo-based studies that are going to show that this is truly doing what everybody thinks it is doing.
absolutely. And why should it not be another arrow in the quiver?
Sure.
Nobody's telling you to dump your whole quiver out, get rid of everything
No,
else, and just put cannabis in. We're just saying that give that as another alternative or another option for a patient who's in need.
that's right. That's right. And look, at the end of the day, it's nobody's fault. I mean, no medical doctor, for the most part, was even trained on the cannabinoid system and how it relates to the use of medicinal cannabis. It's all been anecdotal research that they may have done on their own or through their own personal experience. So I think when that starts to change in our country, you're going to see the mindset change in a more holistic way.
Absolutely. And I think that's where it becomes very incumbent. One of the things I've been saying for years now, and I've been involved in this industry for over 20 years, is that one of the things that we do really well at is B2B. There's a plethora of information out there to help you get a grow started, to help you get a processing plant started. But we don't do such a great job B2C. And I'm not talking about botanical sciences. I'm talking about just as an industry at whole. We literally, I think everybody went, we hit 2018, 19, and we got all these states, and now 2023, we got 37 states in the District of Columbia now that all have some form of cannabis law. So everybody kind of wiped their brow and said, "Oh, yeah, we're moving ahead." But then we forgot to educate the consumer. And we take a look at what Big Pharma has done for the last 20 years. That's all they do is shove products down the consumer's throat all day long. If I turn on my television right now, I guarantee I'll turn it on and there'll be an ad. And now they'll let them advertise those drugs, but they will not let us advertise ours, which it seems just crazy to me.
Yeah, and look, those types of things also. I think again, I think we're in this change period where, look, if it changes federally, you're going to see companies that are coming from big pharma and big alcohol, big tobacco, the large industrial companies and industries that have existed for years are going to jump in with both feet. That's my 2 cents because they see an opportunity to not get disintermediated, right? Because cannabis has taken away a lot of the folks who've drank alcohol for years. Cannabis is starting to eat into pharmaceutical companies' profits in some way, shape, or form.
Not just here in the United States. I just read a story that blew my mind about the fact that around the world,
Yes.
consumption of wine is down, I think, 16% to a point that it's at almost a dangerous tipping point
Yep.
because of climate change and other things that have been happening. The impact on vineyards around the world has been devastating to some. Other
Right.
places, the new climates have actually given birth to new successful wineries. However, the
Yep.
overall consumption of those kinds of spirits is down. I think between 9 and 12%. The
Yep.
overall consumption of spirits is down somewhere around 60%. And so, people are starting to recognize around the world. It's the rest of the world. When China is now, somebody told me recently that they probably have close to 1 million acres of hemp being grown in China right now. Million in South Africa. There's a couple places. Then there's a company there, um, Afrohelios, which is a company that has 1 million hectares of property just for growing
Wow.
cannabis and growing hemp. And in Colombia, Colombia, and now and there in the last 2 years alone, I think there's been well over 200 companies that have pulled out of the UN treaty that stopped and banned
Mm.
the exportation and importation of hemp, and now are doing so. So the rest of the world is getting ready to jump, has already jumped 2 feet into this.
Yeah.
America's got to keep up.
Yeah. Yeah, I mean, and that to me gives us promise also that when you see things changing around you. Now, we're not necessarily Europe or any other continent for that matter, but I do think that many of these big companies in large industries are sitting on the sidelines just waiting for the federal prohibition to go away before they engage, and
And
that's a
some
good
of
thing because look, the writing is on the wall; it's coming.
I think some of those that you think are sitting on the sideline have their little private, top secret laboratories already producing products, getting ready so that if anything changes, they can jump in with 2 feet.
Yeah, I'd place some money on that bet.
Yeah, I would too. I'm telling you. And the botanical science is looking to expand in other states.
Well, look, I mean, we're very much focused on the state of Georgia. We're from Georgia. We're Georgia grown. We proudly wear that Georgia grown symbol. But as you're aware, one of the last groups of states in the country that have yet to go through the process are in the South. So you've got the states of North Carolina and South Carolina and Tennessee and Kentucky that just legalized medicinal cannabis, but those others haven't even gone through the formal process yet. It's been in their legislatures, hasn't passed.
And,
So
and a lot of those states that it hasn't passed, the black market in those states is robust,
yeah,
booming,
yeah,
thriving. I mean, I go to Tennessee. I've got family in Tennessee, and I know that there is a black market
right,
in Tennessee. But for me, and I've been a consumer of cannabis products for over 20 years. I can't bring myself to buy anything off the street. I can't
right,
because I have no idea how they're processing this. And a lot of people don't even recognize, don't even remember that it was the South. People think that Humboldt County in California has always been the leader in cannabis. That's not true. It was
hmm,
Kentucky, Tennessee, those areas of the country that had the cornbread mafia
yeah,
that had some of the biggest busts in cannabis in American history. A lot
mm,
of what we thought was weed coming in the United States from Mexico was really coming from Kentucky and had always been coming from Kentucky. So
yeah,
it's not like America hasn't known this for a long time. It's just that we are just now starting to let some of the truths come out.
yeah. And look, and as they go through their process, in fact, a couple of those states that I mentioned, they've actually reached out to our cannabis commission proactively, and as they were starting to form their process or their bill that would go through the legislature, they wanted to talk to our state and then also a company like us specifically to see how we're doing things. That's very flattering, right? If a state potentially is going to model or potentially model some of its legislature off of how we're doing things, I would be honored to be able to do that. Now, that doesn't earn us the right to be able to sell products in those states, but if the opportunity were to present itself in the future, we would certainly entertain it.
And would you be willing to partner up with some groups to help them get started?
Oh yeah, yeah, for sure.
I mean, I have walked through your facility and thought that that's one of the finest facilities I've seen in the country.
Thank you very much. We appreciate it. We take great pride in it, and as you know, it's been a work in progress for a few years, but we're up and running.
Sure. And now, just with your crystal ball on, I mean, how do you think the Fed's going to, change its attitude, or is it going to change the? Could you crystal ball and get an idea of when you think federal legalization or federal decriminalization or federal descheduling? Give me an
Wow.
idea of what you think.
Yeah, I mean, obviously, we're anybody in this industry is trying to put their Karnak hat on now and figure out what the future holds. But coming into a presidential election year, knowing that this position was already taken by the Department of Health and Human Services to reschedule the position to the DEA to reschedule cannabis is a big deal. And I know that you can't overstate that. The one thing that I do know is that there isn't an example where the HHS has made a formal recommendation to DEA that has not been accepted. So that makes me feel good that there is change afoot, that something is going to happen here and that will materially create the momentum behind this industry. Obviously, that's also that optimism was reflected in a lot of the public cannabis company stocks when this news first came out in August. So I think everybody believes something is there to happen. I do believe if we're going to see it, it's going to happen in the first quarter of 2024, so that at least the Biden administration could get some nice tailwinds from potentially making that move.
Well, I
Uh,
mean, and I'm not, this is not an aspersion when I say it, but we know for a fact that the Biden administration, through Kamala Harris and Biden himself, right before the election in 2020, of course, they stepped up to the plate. So as soon as we get in office, in the first 100 days, we're going to make some significant changes to cannabis. I was like, shit, do you know what up? However, however, they're going to make that promise again. And I have a feeling this time around that the constituents of America or the
yeah,
voting public is going to hold them to the fire this time.
yeah,
You know?
yeah.
And
I think that's true. And again, I don't think that particular recommendation can be understated enough. It's like, wait a second, you literally going to change the schedule from a 1 to a 3, and that opens this entire market up to all of those types of businesses that were maybe sitting on the sidelines, who were concerned about that Schedule 1 kind of connotation. And I can tell you, just from interacting with providers around our state, it's still like, oh, they're a little taboo about, hey, it's a Schedule 1. Even though, like you said earlier, everybody we know is either consuming it or has consumed it or is thinking about consuming the products. So there's just a ton of hypocrisy, in my opinion, that's going on. But at the same time, we're going through this great time of change. And when that happens is where you see the most activity, and that's what we're experiencing at the moment. So I'd like to think it's all going to come to fruition in 24, which is really exciting.
if people wanted to get more information about botanical sciences, where would they go?
Yeah, we've got a great website, botanicalsciences.com. We try to be a portal and a hub for information and education about cannabis. And if anybody has any particular needs or interest, we've got an opportunity for them to free form questions to us as well. So we just appreciate the opportunity to serve the patients of the state of Georgia.
I just want to give you one more chance to amplify something else that you said. When you talk about education, you are already affiliated or at least partnering up with several different universities in Georgia, are you not?
Yeah, we are. We're actually affiliated with two historically black colleges in Georgia that we went to partner with going into the RFP process. And also other major universities, Georgia Southern University in South Georgia as well, just on the agricultural side. So we're super excited about the prospects of being able to do things with universities to, again, further legitimize and bring this industry to the mainstream, um, as it continues to unfold for our country. So I'd like to think we're going to be taking a leadership position as a company and a state. We're the eighth most populous state in the country. I know a lot of people may not believe that, but there's over 11 million people in Georgia. So I think we can make a difference together.
Absolutely. Anything else you want to add, sir?
Now, this has been great. I'm so appreciative of everything you've done, Montel. Your advocacy for this industry, your advisement to our company. And without voices like you and what you represent, this industry would be way, way far behind. So thank you for that on behalf of
Well,
everybody.
I thank you too, and I thank you so much for recognizing and allowing me to be a part. I can't wait to get our products, in your facilities, and I can't wait to come down there and try to do more education if I can.
Excellent. Thank you so much for having me.
For sure, absolutely, sir. And if you want more information, make sure you look up botanicalsciences.com. Is that right?
That's right.
Botanicalsciences.com. Thank you so much, Gary Long, for being a
Thank you.
part of Let's Be Blunt with Montel. And thank you for tuning in today to this edition of Let's Be Blunt with Montel. Thanks for joining me on Let's Be Blunt with Montel. Please make sure you're subscribed and hit the bell to be notified when new episodes post each week. We'd love to hear your feedback also, so please send us your comments.